Good afternoon and welcome everyone to this interactive workshop to introduce you to our serial prescription toolkit. And just to remind you all that this session is being recorded. It's really encouraging to see so many of you joining us today. We have over 160 people registered for this workshop and over 500 people across all four. And we are aware of the sustained level of pressure being experienced by your teams. So we'd like to take this opportunity to note our appreciation and really thank you for investing your time in joining us. Next slide, please. So we'll start with a quick introduction of the presenters for this session. My name's Eloise Johnston. I'm the Senior Improvement Advisor who's leading these digital workshops to help you implement serial prescriptions in your practices. We're joined today by Dr. Graham Gould, who's our GP clinical lead, and Adeline Tan, the team's improvement advisor. Many of you will know Leslie McFarlane, who was the senior improvement advisor leading the pharmacotherapy collaborative both before and during the pandemic. She's moved on to a promoted post within Healthcare Improvement Scotland as a portfolio lead in excellence in care, and we're grateful for all the hard work she put in getting this toolkit published and wish her all the best in her new role. We're also delighted and grateful today to have Elaine Payton, Margaret Robertson and Caroline Gould on the workshop with us. Elaine is NHS Greater Glasgow and Clyde Senior Prescribing Advisor. Margaret and Caroline are the Chair and Deputy Chair of the National Community Pharmacy eHealth Facilitators Group. And they're on hand today to respond to queries in the chat box as we're going along. I'm going to hand over to Adeline now for some housekeeping.
Thank you, Eloise. I'm Adeline, and before I start, I'd like to run through some basic virtual housekeeping to ensure you get the most from this experience. To minimize noise interference and maintain streaming quality during the session, we have muted your microphones and turned off your cameras while listening to the presentation. We will be recording this workshop and it will be posted on our pharmacotherapy website. We will email you to let you know once that is posted. We have set time during this session at different points to pause for you to ask questions and for us to answer. You're invited to interact with us during these pause sessions by raising your virtual hand and unmuting your microphone. We also invite you to use the chat box to ask questions throughout the workshop, and you should find the chat icon at the top of your screen. We have recorded the Serial Prescription Toolkit webinar and will be publishing it shortly on our pharmacotherapy website. We will be adding to the resource from this series of digital workshops, and the update will be available towards the end of January and will be circulated soon after. If you are experiencing any technical issues, please let us know in the chat box so that we can help you resolve it. Finally, please note that any text in the chat box and any verbal communication are recorded and will be published on our pharmacotherapy website. Next slide, please. The aim of this session is to provide you with a demonstration of the toolkit's functionality, an explanation of how to assess and apply the practical resources within the toolkit, and an opportunity to ask questions and share experiences of setting up or reviewing serial prescription processes in your practice. We will be discussing Step 3 and 4 today. And our workshop's target audience today are the GPs, primary care pharmacy teams, other primary care prescribers, and administrative staff. Whether you're from one of these groups or play a different role, you're all very welcome today. Next slide, please. We'd like to learn a little more about all of you. If you can pop into the chat box your name, where you are in Scotland, if you had joined our Serial Prescription Toolkit webinars in October or the past 2 digital workshops, as well as your expectations for joining this session today. I'm going to keep talking while you do that. And if you look at the heat map on our screen today, it's really nice to see where everybody is joining us from. And the stars on the map show the spread of our attendees from the introductory webinars in October. I'm going to hand you back to Eloise now.
Thank you, Adeline. So thanks everyone for participating so far. It is really helpful for our planning for us to understand where you're all joining from and which professional groups are being represented on these workshops. So while your comments are continuing to pop up in the chat box, I want to take a really brief pause here to set out our intention for the atmosphere that we'd like to create for today's workshop. We know from our collaborative work with primary care teams over a number of years that someone in the room usually has the answer, and our role today is to present the resources and, probably more importantly, provide the opportunity for you to ask questions that will help you to plan and implement serial prescriptions. This is the third of 4 workshops, and the focus today is on the stage of setting up a serial prescription. We're going to take you through the toolkit to show you more of the detail. We won't have time to open every individual document. However, we will explain how the toolkit is structured and will highlight all the resources that are included within it. Next slide, please. This slide shows a really helpful document that's currently hosted on Scottish Government's website and sets out what the Medicines Care and Review Service means for patients. And it describes serial prescriptions as pharmacies working with GP practices to help people get their medicines at the best time for them. If people are prescribed regular repeat medicines, they may be able to have a serial prescription if their prescriber thinks it's suitable. A serial prescription can be issued for 24, 48 or 56 weeks, and it will be kept by the community pharmacist who will dispense it in regular intervals as prescribed. This means that people can get their repeat medicines straight from a pharmacy without having to order a prescription from their doctor beforehand. And when transferring to serial prescriptions, it's essential that you first test your processes to ensure that they're safe and improve quality for the practice and patients. And some of the benefits of using serial prescriptions: it can be more convenient for patients, it can reduce unnecessary footfall and some of those phone calls to the practice, it can reduce some of the workload within the practice, and it absolutely supports community pharmacy in being able to coordinate and manage their workload. Next slide, please. So we initially started work on the Pharmacotherapy Collaborative at the end of 2019, and when we remobilised after the first lockdown, the feedback was that a focus on implementing serial prescriptions would be most useful to practice teams. Between November 2020 and March 2021, we worked with 53 GP practices across 8 health and social care partnerships in Scotland to develop and test new and existing practical guidance and resources. The resulting toolkit you can see on the screen is a combination of national NCR, some co-produced iHub, and some local resources. We're absolutely delighted to have had the toolkit endorsed by RPS, and we're currently working through that process with our CGP. So the toolkit is designed as an interactive PDF and is built on a cycle of 5 key steps. Plan for serial prescription processes in your practice, select your patients, set up your serial prescription processes, discuss serial prescriptions with your patients, and start dispensing. And at the centre of the implementation sit the quality improvement or QI tools that support these processes. And it won't come as a surprise to anyone on the session today that GP practices all have degrees of variation within serial prescription processes and experiences. And this toolkit's been designed so you can click onto the icon that you want to review. And the toolkit only consists of 9 slides in total. So you can scroll through or click on any of the icons highlighted in red, which take you directly to a specific page with a range of relevant resources. Next slide, please. So this is what the page of resources for each step looks like, and we've used today's stage of setting up a serial prescription as an example. And as I talk through how it's structured, you'll be seeing small red boxes appear which highlight the different parts of the page. So the page is divided into purpose and resources. In each purpose, there are some resources which have been categorised into a guidance, a tool, or training, and each resource has an icon to denote which category. Where you can see something listed in bold text, that denotes that it's a key document, and some steps in the toolkit also have additional sections on good practice resources. And at any time that you wish to return to the front page of the toolkit, you just click on the home icon at the bottom of the page. Next slide, please. So just before I hand over to Dr. Graham Gould, who's going to take you from this slide on, I'm going to make one small additional point, that some of the documents we link to within the toolkit still use references to CMS rather than serial prescribing. And whilst we know the term CMS is a little outdated, the processes are the same. So today you might hear us referring to CMS, and that's where it matches what's in the document. And hopefully that will avoid any confusion as we go through. And at this point, I'd like to hand over to Graham.
Thanks, Eloise, and welcome everyone to our third workshop on the pharmacotherapy toolkit. It's great to see the diversity of attendees and health board areas represented again this afternoon. So we're going to start off promoting the benefits of planning, and for this we're going to walk you through a couple of documents. Before we do that, I'm going to illustrate one of the key national documents that we introduced during Workshop 1. That was the planning stage, and it's this Journey of a Serial Prescription Process Map. This is designed to help your teams walk through your current process and to identify any gaps. And as a brief reminder, in the previous workshop we covered inclusion-exclusion criteria, shared care agreements, identification of potential patients, and the screening and review of individual patients. Next slide, please. Now we've reached the point where medicines can be transferred to a serial prescription. The first document from the toolkit that we will be taking you through today is SR03, switching a repeat prescription to a serial prescription in EMIS. Consider staggering your serial prescription initiation so that subsequent review workload is spread out evenly throughout the year. It's also helpful to discuss the numbers with the community pharmacies, as currently they must register the patient if they are not already registered. And a stage 1 medication review needs to be completed. Using your approved list of patients to be switched to a serial prescription, you need to check that the CMS default script duration for 56 weeks is selected. You start by selecting the patient and sending a letter to explain that they have been selected for a serial prescription. And then check the patient's preferred community pharmacy for collecting their prescription. Using the medicines management link, add a consultation to the patient's record. In the comments section, enter your job role and details of the consultation. Then right-click to add the read code 66RE. This is serial prescription issued. EMIS needs the read code to allow users to search for patients on serial prescription. If a serial prescription is issued, double-click in the medication section of the consultation. Select each item individually and then change the prescription type. Select CMS, CMS initial setup. Care should be taken at this step to ensure the dose, quantity, duration and frequency is correct. All items in a patient's serial prescription should be issued at the same time to ensure that they are all running concurrently. Again, select 56 weeks duration, as this allows for annual review ahead of the reissue of prescription. Dispensing frequency would normally be for 8 weeks. Then check quantities using the table for 56-week prescriptions. Repeat these steps for each item to be changed to a serial prescription. Please note, once a serial prescription item has been issued, it cannot be altered. It has to be cancelled and restarted. To cancel a serial prescription item, select the item to be cancelled, right-click and cancel item. Remember, you can add the name of the pharmacy and destination text box so that it prints out on the prescription. Then issue and print the serial prescription. Add the letter to the consultation, save the consultation to the patient's record and exit the patient record. Mark the bottom left-hand corner of the prescription to let the practice staff know that it is a serial prescription, and annotate the name and location of the pharmacy the prescription is to be sent to, if not already noted and recorded on the prescription. Next slide, please. So here we're going to go through the same process for vision, and this is SR05, producing a serial prescription in vision. Again, as I've already said, consider staggering your serial prescription missions so that you've got your subsequent workload spread throughout the year. And again, continue to discuss the numbers with community pharmacy if the patients are not already registered, and do a stage 1 medication review. To ensure that a patient's prescriptions are converted to serial prescriptions, if they are appropriate, it is important to update the patient's record to show whether you consider them suitable or not suitable for this service. This can be done ad hoc, as in when you're in contact with the patient, or when admin staff provide you with a list of patients who have already registered for CMS with a pharmacy. Please note this is also known as MCR. Within the patient's journal, click on the Patient Details tab, then click Change within the CMS field. This opens an e-pharmacy window. Click on CMS Suitable or CMS Suitable as appropriate. Then type any relevant information in the Reason for Change window as required. Don't forget to save this step. The patient's suitability status is now displayed on a button in their Therapy tab. If you wish to change the patient's suitability status, you can do so from here by clicking on the CMS Suitable button. This then takes you to the Patient Details tab, where you can carry out the change required as per the instructions we've given. If you hover over the MCR CMMS button within the Patient's Therapy tab, it will display the pharmacist the patient is registered with and the date they registered. Note, if the patient has not registered for MCR or CMS, nor had their suitability determined, there will be no button there at all. Identifying unregistered patients suitable for a serial prescription, it is now possible to create a serial prescription for a patient who has not yet registered with a pharmacy if you consider them suitable. It is important that patients are made aware of this option, either through a conversation with practice staff or by a notice attached to their prescription. The latter note informing them that, on presentation of the prescription to a pharmacy, they will be required to register for MCR CMS, and will then need to collect any further issues of this medication from that same pharmacy. There are various resources within the Serial Prescribing Toolkit, such as patient letters and patient-centered discussion checklists that can support practice with this, and these were highlighted in previous workshops. To start a serial prescription from scratch, start with the Patient's Therapy tab. Click on CMS. Add any existing CMS prescription. Any existing CMS prescriptions will be displayed in this view. Search for the required medication as normal and complete the dosage instructions. Click the CMX box on the right of the repeat master and add the window. Once you tick the CMX box, additional fields will be made available for medication term and dispensing frequency. Once you've chosen medication term, usually 56 weeks, and the dispensing frequency, hopefully 8 weeks, the system will usually calculate the total quantity of medication required for this term. If it has been unable to do so, the quantity box will be highlighted in yellow and a manual calculation is required. The prescription is now available to issue and print on the CMS tab. If you're starting a serial prescription from an existing repeat, begin with the Repeats tab in Therapy. Select the drugs which you wish to change to serial prescription, and then click on the Reauthorize icon. This brings up the Reauthorize Repeat Master window. Click the CMX box, then continue as per instructions for setting up a new script from scratch. The original repeat is inactivated within the reason reauthorization, and a serial prescription is created in its place. Vision sites do not need a read code, and as we've highlighted previously, some of the language in SR05 is a little outdated, although the process is still accurate. Next slide, please. Okay, so at this stage we're hoping to respond to any of your queries. I know there's a lot of information being given in the last two slides, and I would really encourage you to try this out yourself, both for EMIS practices and vision practices, and just get familiar, if you're not already, with how to do the process within your own system.
So we just have one question asking if there's going to be a vision compatible template sent out for letters, and Margaret has replied saying that there are suggestions within the toolkit itself. And the other question is that if the vision sites don't need a read code, how do we identify how many patients are on serial prescription?
I mean, you could still use coding, read coding within Vision to search for the appropriate patients. And another way of doing it is versus the Scottish Therapeutics Utility, or STU. And within that, you can look to see what your percentage of serial prescriptions are versus your percentage of normal repeat prescriptions. And I think we've got some other answers coming up in the chat box as well. Margaret's pointed out you'll need a CAI number if you're doing a search. Okay, shall we move on? Next slide, please. Setting up a serial prescription. The following list provides suggested limits when prescribing as directed or when required items, based on the most common or maximum doses. Clinicians should review and adjust this based on individual patient need and previous prescribing history. This has been calculated in this example to show the worked examples for items dispensed on a 56-week serial prescription with the quantities and dispensing frequency required. There are a couple of good practice statements to highlight here. Saving time, helping patients, a good practice guide to quality repeat prescribing. This was produced by the National Prescribing Centre in January 2004. And also from the BNF, dose and frequency should be stated. In the case of preparations to be taken as required, a minimum dose interval should be specified. And that's in the prescription writing section near the front of the BNF. Next slide, please. So apologies here to our EMIS users, as this slide doesn't have an equivalent. The toolkit includes a couple of vision-specific training video resources that have been shared with the kind permission of Cegedim. One that provides an overview of serial prescription, and one that covers dispensing, TSRs, mail manager, and reauthorization. If anyone knows of resources like this for EMIS, please get in touch and let us know. Next slide, please. So again, we'd just like to pause and reflect on any questions that have come up in the chat box. And Adeline's put up the links for the two good practice points from that last slide. And Elaine's helped us with a guide for PRN or as required prescribing? Okay, if there are no other specific questions or comments, let's move on. Before we discuss printing, we'd like to highlight at this point in the process that it's a great opportunity to have a discussion with the patient. And we will cover how you do that and some resources to support how you would progress that through the workshop later this afternoon. We're now going to look at printing a serial prescription. The serial prescription is now ready to be printed for signing according to your agreed practice workflow. Prescription should also show the preferred community pharmacy for onward distribution. A key point to note here is that the shared care agreement within the toolkit can be really helpful in supporting discussions and planning with your community pharmacy or indeed pharmacies. Patient information letters can be printed at this stage, ready for distribution by appropriate staff, either directly to the patient or via the community pharmacy. We can discuss this again later as we progress through this workshop. Next slide, please. Here we have an example of the joint working agreement discussion points. This was produced by NHS Grampian, and this is another locally developed document that you might find helpful to consider. And within this, steps 4 and 5 in particular provide some guidance around converting medications to serial prescription and issuing the serial prescription. Next slide, please. And after we've paused for any questions or comments, I'm going to hand back to Eloise.
There are no questions, but Elaine's made a suggestion and advised that PRNs are printed on a separate serial prescription form, as it makes it easier for the patient and the community pharmacy clinics when dispensing them.
Yeah, that's a good point. Thanks, Elaine. And if there are no further comments just now, please keep thinking of questions you might want answered. We do have further opportunities later in the workshop, and over to Eloise.
Thanks, Graham. And that's the next slide. Thank you. So as Graham mentioned at a couple of points when we were talking through the technical steps of the process, there are opportunities to have those discussions with patients about moving them on to serial prescriptions. So at this point in the workshop, we're going to look a little more closely at communication. If you've attended one of the previous 2 workshops, I'll apologise in advance that we're going to be covering the same resources. And obviously this is for the benefit of those who are attending today for the first time, and hopefully there still will be an opportunity for everyone to learn something. So clear and effective communication with patients is really key to an efficient transfer from repeat to serial prescribing. And when undertaking a move to serial prescriptions, you should consider at the earliest stage how to discuss with and inform your patients of any changes. You and your teams know your patients best, and good practice is to get consensus within the team on what your communication strategy is going to be, and it's really helpful to agree it within your shared care agreement before you move on to selecting and screening your patients. And the shared care agreement is hyperlinked within the toolkit. Next slide, please. The first thing to consider is how you have that person-centered discussion with your patients. As you'll know from today's session, an awful lot of the content has been focused on the process steps around moving repeat to serial. And so the potential is that this discussion ends up being framed with the patient as a process-centered conversation, whereas it's more important that these discussions are actually person-centered. And the key element of this really should be about how serial prescriptions can benefit your patient. And there's a key document within the toolkit called Questions to prompt a person-centered discussion, which can really help you with these initial discussions and can be useful at a review stage, particularly that first review. Next slide, please. And this person-centered discussion checklist is another key document that will help you around those initial discussions and also at the review stage, again, particularly at that first review. And if you've taken Graham's advice and kind of managed your workload over the year, hopefully you'll be doing those first reviews in a very manageable and sustainable number month by month. So at this point, can I have the next slide, please? We've just got another quick pause to see if anyone has any questions or experiences that they might be able to share in terms of having those discussions with patients that are moving on to a serial prescription.
And a good point in the chat box from Caroline as well, just to say that the NHS Grampian document can be used alongside the national shared care agreement that we have in the toolkit.
So I can't see the three dots that suggest that anyone's typing a question in. So I think if we move on to the next slide, and if anything comes up, feel free just to pop it into the chat box. So we're going to think about how and when it might be useful to consider written communication to your patients. And within the toolkit, we've provided a couple of examples for you to have a look at. So you could provide a patient information letter or a leaflet to inform your patients of the basic changes to the system. And written communication also gives you that opportunity to provide any reassurance that might be required around areas of patient care which are going to be unchanged, but may be of concern to them, such as would it affect their ability to see their GP. Next slide, please. And within the toolkit, again, you'll find a hyperlink. So this is a locally developed patient information letter that was kindly shared by the Kiramio Medical Practice in Tayside as an example of the kind of document that you may be able to produce locally. Next slide, please. And this one, which was shared by NHS Highland, is an example of their locally developed patient information letter. Next slide, please. Again, we're just going to take a quick pause here to see if anyone has any questions or comments around using written communication with patients. Have you used letters, leaflets, notes stapled to scripts? Do you have any questions about how that might work, or experiences to share about how you've maybe already put that in successfully within your practice? You'll see there's a note just gone into the chat box from Caroline there around attaching leaflets to the front. It's a good way of letting the patient and the pharmacy know that it's a new patient onto serial prescribing, and absolutely your board might have local ones available already. Thanks, Hilary. That's interesting in terms of face-to-face. So over these workshops, we found quite a variation, and some practices have found that those face-to-face discussions are better. Some practices have used phone calls. Some are using letters and leaflets. Some use text messages. We've had practices who shared information on their website and been linking patients to that by text message. So I think there is an opportunity to be creative here if you can, if you've got those systems available to you. And obviously we've got the examples in the toolkit if you're wanting to have a look at what other people have been using across the country. The question in from Kimberly, I'm not even going to begin to assume that I have the answer to that one, and hopefully somebody in the workshop will be able to come in with some comments that will be helpful around, because there's not many patients coming into the surgery, it's harder to promote. Has anyone been able to actually make headway with promoting the service, and how you've done that? So what we'll do is we'll move on to the next slide, and hopefully if anyone's got any suggestions for Kimberly, they'll be able to pop them into the chat box. And we'll be providing a summary of all of the discussions once we've completed all 4 workshops as well, that will sit on the website with the recordings. So obviously the toolkit in itself, in a vacuum, has limited use. This is really about a starting resource for you to understand your local processes and for your practice to be able to implement serial prescribing. And how each practice uses the toolkit will differ. So you really need to think about how you're going to build serial prescriptions into your daily practice processes. And as an example, staggering serial prescriptions for your patients by their birthday month, so that when the time comes to the review, they're obviously not all coming in a wave at the same time. And taking that measured and balanced approach towards your practice's workload. And obviously that has the same impact then on the community pharmacy, that it's measured and balanced and agreed. All of these things will help ensure that sustainability in terms of workload, both for the practice and for the pharmacy. And at this point, I'm going to hand over to Adeline, who's going to talk you through the next couple of slides.
So there is a suite of QI tools that you can freely access to support implementing your serial prescriptions. We've only highlighted some of the tools today. A driver diagram visually presents a team's theory of how an improvement goal will be achieved. A process map helps the team visualize your serial prescribing process. PDSA stands for Plan, Do, Study, and Act. PDSA cycles are an ideal QI tool that can be used to test an idea by temporarily trialing a change and assessing its impact. A data measurement plan sets out details for each measure proposed for an improvement project, and a data collection template helps you to collect appropriate data for informing your work. The link to NASU QI Zone, where more information on how to use the QI tools are shown in the chat box and in the serial prescription toolkit. You may also have access to your local QI support team. These specialists can help you understand these QI tools more in depth. The other local specialists you may be able to call on is your local e-health facilitators. They can also help support your implementation of serial prescription toolkit. I'm going to hand this over to Eloise now.
Thank you, Adeline. So you'll be pleased to know we are pretty much at the end of the workshop, and there's been a few more questions and comments that have come into the chat box. So just to remind you, we will be taking all of the information that's been shared in the chat box and putting it together into a document that summarises some of the questions and responses, and they'll be made available alongside the recordings of these workshops when they go up onto the website, and you'll all receive an email notifying you when that happens. So don't worry if you think you've missed an important piece of information, it will all be available to you later. So in terms of the session today, obviously if anything's come up where you have an extra question, please drop us an email to the team. And if when you go away and actually start using the resources within the toolkit, if you're having problems accessing any of them, please get in touch with us and we can put you in contact with the correct expertise, probably locally. And we know that everyone is really busy. We're grateful that you've taken the 45 minutes out today to join us. It would be really helpful for us to understand how you've used today's session in terms of how you found the learning. And we factored in a couple of minutes at the end of the session just now for you to complete the little feedback survey. So this does help improve our workshops. We've already had some great learning from sessions 1 and 2, and hopefully responding to those workshop by workshop. So the link will be in the chat box. And if you click on it, the survey will pop up. Complete the survey for us, please, if you don't mind. Responses are anonymous. Please be as open as you wish. And once you've completed the survey, please feel free to log off and enjoy the rest of your day. And in the meantime, it remains for us to thank all of you again for your time today and wish you all the best in setting up and reviewing your serial prescriptions. Please keep in touch. Let us know how you're getting on. And one last thanks for this afternoon to the behind the scenes team who've kept us all running this afternoon in terms of the technical performance. I'm very grateful. And another thank you again to Elaine and Margaret and Caroline for joining us and being able to answer those questions in the chat box. So if you can see the survey, we're grateful and have a wonderful afternoon. Thank you.